My name's Beth Gullone, and I'm a family doctor here at Midwest Medical Center. I grew up in McHenry, Illinois, which is about an hour north of Chicago, and came out to Loras College for my undergraduate program. I did a major in Spanish and a minor in chemistry. While I was at Loras, reason I chose Spanish as a major instead of a science is I knew I wanted to be able to speak Spanish and knew I would use it in medicine to communicate with patients. I was also lucky enough to study abroad and studied in Costa Rica and Guatemala during my time at Loras. After Loras, we got into medical school and I went to University of Illinois. First year was at Champaign and then 3 years in Rockford through what they call their RMED program, or Rural Medical Education. During medical school, I met my now husband, Beth Gullone, and he also did the rural program, and we trained together and got married after medical school. We were both able to get into the same residency program, and we did family medicine residency in South Bend, Indiana at Memorial Family Medicine residency program. I also had a childhood friend who had a lot of heart problems and was always going in for surgeries, and that was always an interest that maybe I could learn how to help her or people like her when I'm older. And it just continued. It was always something I enjoyed. Pretty much I was lucky to know that it was what I wanted to do, and there weren't really many other things that I was interested in doing. I definitely enjoyed what you would call geriatrics, so the older population, and really do enjoy that. I was able to become medical director at the nursing home since I think 2016, so that has increased my patient population over there as well. And on top of that, I do still see a lot of kids and really enjoy that. Also, women's health, I do like to do a lot of the birth control procedures, regular female exams and PAPs, and joint injections, skin biopsies, some minor fracture care. But I think really my favorite is that I can and like to do pretty much everything from birth to end of life, and having that variation throughout the day and even between patient day to day. Outside of work, pretty much my time is consumed with my kids. I have a daughter who's almost 10 and a son who's 11, and any free time we have is basically spent with them, whether at home, whether with their sports or other activities that they have. I also really enjoy reading books, fiction, nonfiction, that are not necessarily medical related, just for fun. I like to do yoga, do sprint triathlons to keep me kind of active and focused. Both my husband and I who work here are from Illinois and wanted to come back to the state and wanted to work in a rural community, wanted to raise our family in a rural community. When we were looking for options, Midwest was fairly new, and there were openings for both of us. When we came to check it out and interview, everybody was very friendly, very kind. I don't know, it just seemed natural. It seemed like a good fit. So, and the town always seems to have something going on while at the same time still being a small town.